Do you think you actually get the best quality of healthcare? Do you think that? It is often said that German healthcare is one of the best in the world. But is that still true today? In my recent discussions with patients, doctors and nurses, as well as other stakeholders in the system, I've noticed increasing doubts about this general perception. Why is that? And why do so many of you think that our healthcare system is facing major challenges? On the one hand, some of these developments are due to natural development. Some of these challenges are due to natural developments. The burden of disease in an aging population is worsened by the shortages of healthcare workers, such as nurses and doctors. On top of that, the impact of COVID-19 and inflation had a negative impact on our system. On the other hand, some of these challenges are also well within our control. The so-called expectation gap in healthcare is widening. Patients have become accustomed to the benefits of digitization in many areas of their lives, such as online banking, shopping, and home entertainment. And then they encounter a healthcare system that does not live up to these expectations. Patients often must wait long times for a doctor's appointment. Our existing system still works in silos and is largely reactive. For example, when you want to request a doctor's letter or lab report from your doctor, or you just want to forward one document from one doctor to another doctor, it is still an analog process, fax machine. So modern digital technology has little penetration in healthcare today, at least in Germany. So in my opinion, the long-delayed introduction of e-prescriptions and electronic health records that have been repeatedly postponed for years is the perfect example for our failure to digitize the system. Let's take this report on the introduction of e-prescriptions from 2002. Can you believe that? 2002. So many of you were probably not alive at that time. Yeah? So after more than 20 years, e-prescriptions are only sporadically in practice today. So how do these developments specifically affect you? Have these developments already had a negative impact on the quality of your healthcare? To illustrate this, I'd like to share a case from my clinical experience as a young neurologist in the emergency room when I was your age. A middle-aged man was brought to the emergency room after an unobserved bicycle fall, so unconscious and with a breathing tube. With apparent head impact, this looked straightforward like a head trauma case. This is why the traumatologists initially took over. They requested a head and whole body imaging to look for fractures and bleeding. The radiologist found none. So with an unconscious patient after a mysterious bicycle fall, we, the neurology team, were called in for further investigation. We directly detected clinical indications of a stroke, positive Babinski sign and deviation of the eyes to one side. With this new knowledge, the radiologist re-examined the head image and directly detected a radiologic sign, the so-called hyperdense artery sign, a confirmation of stroke. The mystery of the bicycle fall was resolved, so bicycle fall after stroke. So in the case of a stroke, the patient's medical history is of critical importance as it may contain vital information for the treatment decision, such as a prior blood thinner therapy or a known disease of the hematopoietic system. Since we knew nothing about this patient other than the personal information from the passport, I desperately tried to call all the hospitals in the patient's hometown to get details about the patient's medical history. So yeah, I felt desperate in this kind of situation. Put yourself in my shoes. I called hospital after hospital. Each time, no medical record. Each time, a dead end. So you're responsible, in charge. I felt lost in the situation. So we had to wait for the lab results to come in, because without the medical history, so we waited for the lab results before we could initiate stroke therapy. And you guys have to know that early start of treatment is critical for stroke therapy. There's a medical saying, time is brain. Time equals brain function. That's what the neurologist says. Unfortunately, we had lost 1 to 2 hours of valuable time. And yeah, the clinical outcome was long-term damage for our patient. So yeah, he ended up in the end with a paralysis of one side of his body and a speech disorder. And yeah, I was responsible in this situation, and you always think about what could have been better. So as you can see in this example, in this case, modern digital technology has little penetration in our healthcare today. This is why I'd like to discuss with you how the determined use of digital technologies could have made the difference for this man. What are the 3 most promising starting points? Number 1, let's start with the obvious. Let's start with the obvious. So I spoke earlier about data silos between practices and clinics. So in considering our case, the existence of an electronic health record would have given us the opportunity to directly obtain the patient's medical history using the personal information from the passport. So is the patient on a blood thinner, for example, right? Very critical in this situation. A timely treatment decision would have been possible. Time is brain. It would have made a difference for this man, for our patient. An electronic health record would give other benefits in the future. Duplicate examinations could be avoided. Physicians could be relieved of pointless administrative tasks like obtaining a medical record, the fax. Or, most importantly, epidemiological research could be accelerated. However, in Germany, less than 1% of those with public health insurance are currently using an electronic health record, which was introduced in early 2021. So less than 1% after more than 2 years? Okay, so now number 2. Let's consider the second starting point. The radiologist had focused on finding fractures and bleeding due to the bicycle fall, remember? And therefore missed the stroke. In this case, the radiologist had a preconceived notion of what the clinic scenario should look like and may have ignored evidence that goes against that expectation. So the brain was too focused on the clinical question, right? So this is why he missed it. So with AI, this would not have happened, as it is trained on repetitive pattern recognition. In this case, AI would have been able to detect the so-called hyperdense artery sign, as you can see here in the image. It looks pretty prominent, but if you're not focused on it in a pressure situation, you're able to miss that. Yeah? So this is also a larger one. So AI detects it, as seen in this image. This is in contrast to humans. Recent studies show that 20% of strokes may be initially missed on imaging, depending on the training of the physician. So by using AI in medical imaging, physicians can detect disease much more quickly, which promotes early intervention. Time is brain. This would have made a difference for our patient. So medical AI models, such as the one described here, are largely developed with a task-specific approach. So one example, a model trained to interpret hyperdense artery sign in images as stroke will only be able to detect that single disease and only from images. So it will not be able to detect the disease based on the patient's medical record or other doctor's letters. So very limited. So you need one model for every data type, images, and for every disease, stroke. are you aware that there's a new paradigm of medical AI, which we refer to as generalist medical AI? So here I compare both. This new AI can process a variety of different data types, images, text, lab reports, to learn specialized medical knowledge and even make a diagnosis, a holistic diagnosis, and an optimal personalized treatment recommendations. So this new type of AI would have been able to write a radiologic report or even say, start the treatment. So this is a unique opportunity to improve diagnostic and therapeutic processes. However, it's worth noting that we'll face ethical questions as AI takes on tasks that directly impact patient outcomes. Number 3, in further clinical course, we discovered an atrial fibrillation, a cardiac arrhythmia, as the underlying cause of the stroke. So mobile sensors built into a smartwatch, for example, could have detected the underlying condition, the atrial fibrillation, much earlier. This would have alerted the patient, or had the mobile sensor been connected to an integrated data ecosystem, the primary care physician. And the primary care physician would have initiated a blood thinning therapy for the atrial fibrillation years before the stroke even occurred. This example reveals many poor health outcomes and death are actually caused by diseases that we already know how to prevent or cure. So just on the blood thinner, some years earlier, this could have been prevented. Digital technologies are key in advancing medicine towards prevention and earlier detection of disease. Mobile sensors enable patients to continuously monitor physiological signs in real time, empowering them to take responsibility over their own health. They can proactively and preventively approach a primary care physician when difficulties arise. Patient empowerment. This stroke case highlighted the challenges that our healthcare system is facing today. What does not work? So you guys must be wondering, shouldn't there be also existing examples that offer a glimmer of hope? So this is why I'd like to share a positive example, what does work, concerning the use of digital technologies in healthcare. So I'd like all men here to raise their hands in the room, please. So I see the hands. Yeah. I just prepare you a little bit as I'm talking now about a little bit more delicate topic. So positive example of digitalization. Yeah. Did you know that 25% of all men over the age of 35 years suffer from erectile dysfunction, ED, or experience it at least once in a while? Okay, I see many young people here. Okay, so my team builds indication-specific telehealth platforms, particularly in areas with high emotional barriers to care, such as ED, erectile dysfunction. So interestingly, from my research, I know that 70% of these ED patients are not in treatment before they used our telehealth platform, 70%. The reason for this is shame. In 2/3 of cases, ED is caused by cardiovascular risk factors. Yeah? So actually 70% untreated, and 2/3 of cases caused by cardiovascular risk factors, like hypertension, diabetes, smoking. So previously untreated patients get access to therapy via our telehealth platform and can then be stratified according to their cardiovascular risk profile. So it's kind of a data-driven, personalized prevention. Patients with cardiovascular risk factors are therefore referred by our telehealth platform to office-based physicians for further diagnostic workup in a kind of hybrid healthcare. As a result, cardiovascular risk factors are detected and treated at an earlier stage. And guess what? Most strokes, like ED, are also caused by cardiovascular risk factors. So ED can be an early warning sign of higher risk for stroke or heart attack. This is why digitization is essential to promote prevention and earlier detection of disease. In taking now all of this together in consideration, is German healthcare one of the best in the world? In my opinion, we have many structures in place to remain a leader in healthcare, such as the quality of the staff in many institutions. However, it has become clear today, modern digital technology has little penetration in our healthcare today. This is why the decisive factor in overcoming the challenges described and improving the quality of care is the immediate determined digitization of our system. We've also talked about priorities today, the integration of telemedicine and mobile sensors, the use of AI in diagnosis and therapy, the need for common data infrastructure with the ability to store our data in an electronic health record. If we focus on these priorities, I am convinced that digitization will not only increase the efficiency of our system, but will also positively impact other dimensions of high-quality healthcare. Think about our stroke patient. Also think about your families, the elderlies in your family, many cardiovascular risk factors. Diseases caused by cardiovascular risk factors are the most common cause of death in the Western world, right? So think about what digitization, what difference it could make in not only increasing the efficiency of our system, but also positively impacting other dimensions of high-quality healthcare. Back to our stroke case. Patient empowerment with easier access to care and earlier detection of disease. More safety in our processes. Better treatment outcomes for our patients. Time is brain. It would have made a difference for our patient. Thank you.